I think it's probably too difficult for most doctors to not only create a website that has the facts, but then to keep them up to date. So it doesn't really make sense for them to try to do that. What makes sense is to find those that specialize in credible information. ACC, Heart Rhythm Society, American Heart Association, and organizations like mine. We're really focused on how can we keep up with the latest science. And I think it makes a lot more sense for doctors not to worry so much about trying to explain the nuances and keep up, because that can really be a full-time job, and they won't have time to do what they need to be doing. So to send patients to credible sites that do have that as a mission is probably a good thing for them to do. I spoke with a doctor right after my last talk who said, is it okay for us to link out to stopafib.org to send patients there? I said, of course. We want you to send patients to our site. We want to partner with doctors to help them educate their patients. We have things like a patient and caregiver resources page. We also have a glossary. So when we're doing an article about new research, let's say, for example, the fire and ice trial was presented here this morning, and I did a video interview with Professor Cook on basically the story behind it and what patients need to know. When we write that story up, we'll put in a transcript, and so any language that the doctors use in doing video interviews, when we do video interviews with them, we will then explain and put those terms in our glossary and link over to that, so patients can not only learn what are the words that doctors use, but they can know what they mean, and they can go get more information about them because we'll link them to the resource on our site that tells more about it. What we can do is that we know that people who have AFib need support. And so they tend to come to the discussion forums seeking that kind of support. And we have a discussion forum. There are several AFib discussion forums on Facebook. There's several on Yahoo. And there are probably 8 or 10 forums out there around the globe. And one of the things that we do is that we're involved in all of those forums. And if a patient brings something up that's really not credible information, or is just plain inaccurate or wrong, we who come to the medical conferences are able to set the record straight so that other patients don't make bad decisions. There may be one patient who's trying it, but we don't want the others to. So that is one of the ways to help them get the right information. And if one of them finds something and comes to a discussion forum and says, everybody go check this out, if we can set the record straight on that, there's much less likelihood that other patients are going to fall for it. And so patients will eventually end up in one of the discussion forums. So that's a great way to keep things straight.